BTEC Tech Award, Level 2, Component 3, Learning Aim A, PowerPoint 5 on smoking, in particular nicotine. Nicotine. Smoking cigarettes or smoking any form of tobacco, usually, though, cigarettes, is legal, but it is banned in public places now. All smoking material now carries a government health warning. For your exam, you will need to know the hazards of smoking, particularly if the individual that they have given you in a vocational scenario is a smoker. So the irritant particles within tobacco and cigarettes can cause bronchitis, emphysema, asthma, smoker's cough, and it can also cause conditions such as a stroke or even gum disease, as we can see in the picture on the PowerPoint slide. Here are some other hazards of smoking. Smoking can cause smoker's breath and the clothes smell of the person that smokes, even those that live in the same household. Nails and hands are nicotine stained, often yellow on the fingers. Faces often become wrinkled from the effects of smoking. The sucking in of the smoke from the cigarette often causes wrinkles around the mouth. The problem of nicotine is that it's very addictive, and once you start to smoke, it can be very, very difficult to give up. In addition to addiction, it can also increase blood clotting, leading to thrombosis. If you have a little look here, you'll see some varicose veins, but the actual smoking itself, especially over a long period of time, can cause blood clots, which is dangerous and can also lead to heart attacks. So what happens if you smoke during pregnancy? If you smoke during pregnancy, there is a greater chance of you having a smaller baby. There is a greater chance of you having a stillbirth, which means that the baby is born, unfortunately, dead. And there is a greater chance of miscarriages, which means that the baby dies before it is born in the womb. So what can a carbon monoxide that's found in cigarettes cause? So it can decrease the oxygen to your body. It can cause poor growth. It can be extra work for the heart and an increased risk of thrombosis. So a child that grows up in a household where either parent smokes or family member smokes within the household can have an effect on the actual child themselves. It can mean that children living in one of those households are more prone to chest infections and they could end up with asthma. They tend to be smaller and weaker, and they tend to do less well at school. To help you understand the dangers of smoking in more detail, you can click on the links or copy and paste the links of the dangers of smoking and have a look at these clips yourself. Additionally, here is a link you can click on or copy. It's about what the government has done to try and prevent smoking in the UK. So, how much does smoking cost the NHS a year? Smoking can cost the NHS approximately $5 billion a year, and that was in 2017. If you look at the table below, which states the NHS event and the estimated smoking-related burden, this was from 2015, where they estimated it was 2.6 billion a year cost to the NHS. So you can see how much it increased from 2015 to 2017. Be very interested if you could research the 2020 costs to the NHS.